we are looking for emergency use authorization today on the vaccine. The Food and Drug Administration is holding a key meeting later today on Moderna's COVID-19 vaccine. If all goes well, this vaccine will be approved, adding another vaccine to America's arsenal to defeat the coronavirus. Joining me right now is the Assistant Secretary for Health at the Department of Health and Human Services, Admiral Brett Giroir. Admiral, it's great to have you this morning. Thank you so much for being here.
Yeah, great to be with you.
Yeah, so tell me about the Moderna vaccine. Are you optimistic we're going to get the emergency use there? And what does that do to the overall arsenal for America's vaccine now?
So I am very enthusiastic about the Moderna vaccine. The summary provided by the FDA shows that it's about 95% efficacious in preventing COVID. It's 100% efficacious in preventing severe disease. It works in the 18 through 25-year-olds. It also works in the elderly, so it works across the age spectrum. And the side effects are very mild, very similar to what we saw with Pfizer. It just means your immune system's working. Sore arms, a little bit of fatigue. What it means is if it is authorized, and I'm confident it will be, that in addition to 2 million Pfizer doses being shipped next week, we anticipate 5.9 million doses of Moderna, so almost 8 million next week on top of the 2.9 million this week.
Wow. So is there any change to your expectations in terms of how many Americans can get vaccinated this year and going into 2021? I guess Alex Azar was saying that we could have much of the public vaccinated by the middle of next year. Is that still on track?
Oh, that really is with a high degree of certainty that by June, anyone in this country who wants a vaccine could have a vaccine. We do expect 20 million people immunized this month, 30 million people in January, and then another 50 million doses in February. Some of those will be first-time recipients, some of those will be getting their second dose, and it'll go up from there dramatically. So we are absolutely on schedule, and it's very exciting. We have work to do right now, but the end of the pandemic is in sight. It really is, and it's going to be, mid next year.
And we thank you, Admiral, your leadership and Alex Azar's leadership, obviously President Trump mobilizing the entire industry. Thank you for coming to the call that you did for America. More of Pfizer's vaccine is expected to go out today with this round of shipments finishing on Sunday. Let me ask you about the side effects. I'm glad you brought that up a moment ago because we are hearing these stories of an allergic reaction. What should people understand about the side effects? And is there a certain demographic that's feeling side effects?
So the only report that we have right now of a serious side effect was one of these allergic reactions. Now, in the United Kingdom, they occurred in people who were sort of hyperallergic at baseline. This was a young healthcare worker who did not have that type of history, and she had an allergic reaction. And if you do the numbers, this is probably going to be in the range of 1 in 500,000 to 1 in a million, which is what you can expect. Now, she was treated immediately with the appropriate anti-allergy medicines, epinephrine and Benadryl, and is absolutely fine. She is really a trooper. If you heard her, she encourages everyone to get vaccinated and is not happy that she can't get her second dose. So we are going to see the 1 in 500,000, 1 in a million kind of allergic reactions. That's why we want to make sure that even in those circumstances, there's the appropriate medications to treat it.
Admiral, is there anything surprising that you have noted in this rollout? What has struck you most? What's most important to you in terms of this rollout that our audience might need to understand better?
So, there's so many things that are important. This is an historic time because we are seeing the end of the pandemic is in sight. We're really doing two things at the same time. Number one, we're trying to get herd immunity by vaccinations, and that will happen when 70 or 80% of the American public is either vaccinated or have had the actual virus. But what we're doing right now is very important because we're vaccinating for real immediate impact. By vaccinating our elderly population, particularly those in nursing homes, assisted living, that's where a large minority of the deaths are. Those are the people who go to the hospital and have prolonged stays. So although we won't achieve sort of the end of the pandemic, we're going to see the burden on hospitals and our mortality rate going down significantly over the next couple of months. So I am excited about that, and I feel for all my frontline workers. I'm an intensive care physician for children, and they have just been heroic during this entire time, and they need some relief, and relief is coming for them, and that's good news for all of America.
That is fantastic news. And given your background, is it fair to say children are not susceptible?
Children are susceptible to the virus, but they have much less chance of getting any severe consequences than adults. I mean, it's very, very small. And I do want to make the point that we are getting more and more information that schools are safe. Even this week, there was a new CDC publication that said that, the rates of positivity in children are not associated with them going to school.
Yeah. That's what I wanted to get your take on. I'm glad you knew where I was going with that. Admiral, it's great to see you this morning. Thank you so much. Again, our gratitude to you and your team. Admiral Brett Giroir joining us this morning. We'll see you soon, sir.